Hi friends, this is Dr. Nikhil Agarwal. I am Principal Consultant and GIHPB Oncosurgeon at Max Institute of Cancer Care. Today we are here to talk about gallbladder cancer. Gallbladder is a pear-shaped organ just below our liver in the upper part, right upper part of our abdomen. You must be knowing this organ because it will form stones and then they require surgery. Sometimes cancer form in this organ and it's a very aggressive cancer. So what are the risk factors of this cancer? So the risk factors for gallbladder cancer are gallstones, like we know stones form in the gallbladder. Again, there are some congenital anomalies of gallbladder as well as bile duct such as choledochal cyst. It also predisposes us to gallbladder cancer. Then sometimes gallbladder wall is calcified called as porcelain gallbladder, that also predisposes us to gallbladder cancer. If someone has family history of gallbladder cancer, that person is at risk of gallbladder cancer. Now if somebody is having this cancer, what are the signs and symptoms, right? So these patients will generally present with pain abdomen or jaundice and unexplained weight loss along with loss of appetite. Now once we suspect somebody is having gallbladder cancer, we order certain tests and then we diagnose and we stage the disease. To diagnose and stage the disease, we do some tests which include a triple phase CT scan or sometimes PET scan and along with some blood tests. Once we have diagnosed and staged the disease, the treatment will depend upon the stage of the disease. So for early stage disease which has not spread and which is not locally advanced, we generally operate these patients. The procedure to remove a gallbladder cancer is called radical cholecystectomy. In this, the gallbladder along with part of liver and adjacent lymph nodes are removed. In an attempt to improve survival, we also administer chemotherapy or sometimes chemoradiation to these patients after surgery. Some of the patients will present to us when the disease is pretty advanced and it has either grown locally or it has spread to other organs. In such patients, our aim is to palliate and only prolong survival. To do this, we first have to relieve jaundice with a PTBD or ERCP, and following this, chemotherapy is administered which will improve survival. Stay alert, stay healthy. Thank you.